for yourself. And second is prevention. What it means is that how can we take care of ourselves today so that we can prevent something tomorrow or postpone something tomorrow. Okay. So what is the meaning of sick care? Sickness means there is a problem and we need to solve that problem. So sick care means when you fall ill, when you're sick, you need to care. So care for the sick. So sick care. Okay. Of course, there are, when you talk about sick care, it is not only chronic diseases, but we are talking about things like accidents, emergencies, poisoning, or acute infections, which really require, medications and immediate intervention. Okay. So when you talk about sick care, it includes everything. It includes acute diseases and it includes chronic diseases like diabetes, heart disease, hypertension, which actually fall under lifestyle disorders also. Okay. So when we talk about, so one is healthcare, now one is sick care. Okay. So imagine a spectrum. When you say a spectrum, it's a line. At one end, you have health, and on the other end, you have sickness. Okay. We, all of us as individuals, we can go from health to sickness, from sickness to health. Okay. All through our lives. All right. Now, how quickly? So when you talk about a acute disease, you can go from health to sickness pretty quickly. But when you talk about chronic diseases, it's not sudden. It's not that suddenly you develop diabetes. Okay. It is once something is happening. Of course, there could be things like family history, genetic history. Of course, it's there. But what you do every day also influences where you go from health to sickness. Okay. So from healthcare to sick care is in your hands. So when we say that, when we say it is in your hands, what does that mean? What it means is that what you do every day, what are your habits, what are your routines, actually defines how quickly you can fall ill or how quickly you can even recover from a sickness. Okay. Now, what you do every day is nothing but your lifestyle. Okay. So lifestyle is defined as anything that you do every day. Okay. So when you talk about habits, you talk about your behavior. When it comes in a pattern and you're doing it repeatedly, it's called a routine. And when the routine is set and then you're repeating it again and again, that's your lifestyle. Now, whether it's a healthy lifestyle, unhealthy lifestyle, that's a different thing. But that is what is called as lifestyle. Okay. So come to think of it, it makes so much sense, right? Lead a good lifestyle, build your immunity, probably you can prevent all chronic diseases, or if not prevent, you can actually, postpone the chronic diseases also. Then why don't we do it? So there are things, there are a lot of theories behind it, but I feel, in my experience, we take ourselves for granted. We take our health for granted, especially when we are young, 20-year-old, 30-year-olds, we are all young adults. We tend to take ourselves for granted. Why? Because we don't have a problem. We don't have a symptom. There are no aches and pains. There is a little bit of acidity here and there, but we don't really take ourselves that seriously, right? We don't listen to our body. So what it means is that we tend to take ourselves for granted up until a point where there is a problem. Now, what is the problem? We got a bad blood report, we got a cough, we got fever, which is not going away. The body's paining so much, which is not going away. We pop some medication, it's not going away. Or we, one of our relatives or family or friends is admitted to a hospital. Okay. You go visit them. Of course, this is pre-COVID I'm talking about. You go visit them and you realize what you could be headed to. So what happens is you develop fear. When you develop fear, you start doing things to help yourself, going for a walk, exercising, drinking water, eating right, whatever it is. You start making healthier changes. But what happens is that fear can motivate you. It's very temporary, right? You go through a couple of weeks, couple of months, you start to feel better, and then you let go. So what happens is that fear is just a temporary motivator. And unfortunately, if that motivation doesn't get converted to discipline, then you can't go into a sustainable lifestyle. Okay. And this is the biggest problem. This is the biggest gap which I've been noticing. Okay. Now, just for a second, let's think of COVID. Just as an example, it might not be perfect, but I think it works pretty well, because when COVID hit us for the first time, okay, as a nation, we realized that obviously it's not any nation, it's as a world, it was such a new disease. We all were going to get it. Okay. But how quickly people recovered from COVID did kind of define their immunity to some extent. Okay. Which is fine. So first wave happened. It was very unpredictable. We all had to be careful. But why the second wave happened? Okay. Why are we thinking of a third wave? What could we have done to help ourselves as individuals probably prevent a second wave, or not, or have a wave which was not so severe? The vaccine is out and all also, then why is it happening? So you have to keep this example in mind and just think about it in such a way that can you start making changes today and then sustain those changes so that you can start building your immunity, you can start building your lifestyle so that you can actually reduce, you can stay in the healthcare side and reduce the burden on the sick care. Now, the question is, why shouldn't we fall sick, right? Why should we reduce the burden on the sick care? Look at what happened. The lack of hospital, lack of beds, lack of, doctors, lack of medicines. Look at the healthcare cost. How much an individual who is falling ill, one injection, one medicine is, so expensive, 20,000, 50,000. So it's a huge financial burden when people fall ill. Okay. Now, of course, like I said, some things are preventable. You take care of those, and some things are not preventable, and you might need a hospital admission, which is okay. I have nothing against hospital admission. Here, I'm talking about things you can do to probably either prevent admission or maybe not get admitted at all, recover at home. And this is not COVID. I'm talking about any disease. Okay. So why is it important? So one, you reduce the burden, financial burden. Okay. But what is more important than the financial burden is the suffering. Suffering who? For the patient, the pain, the anxiety, you're going through so much when you're unwell, right? You can't do anything. But it's not only the patient, but it's also their family, their friends, their relatives, people who are waiting outside the hospital, people who are waiting at home just for people to get better. So it's not only the financial cost, it's actually the suffering that a person goes through, which makes me think that why don't we continuously take ourselves to, possibly avoid such a situation. All right. So I very strongly want to talk about, healthcare and sick care in such a way. So you've understood, right? So now you've understood the gap. So now the question is that how do we fill this gap? Okay. Now there are quite a few ways to fill this gap. Okay. But today I'm going to concentrate on something called as integrative medicine, integrative system, integrative nutrition. Okay. So what is the meaning of integrative? Very simply put, when two or more things come together to form a better or a more efficient system or an efficient unit, that's called integrative. Okay. Obviously, when you're talking about integrative medicine or an integrative system, let's talk about an integrative system. Now, think of Luke's, the ecosystem that Luke has created. Okay. We have nutritionists, we have allopathy doctors, we have lifestyle coaching, we have, yoga therapists, we have counseling, we even have homeopaths, So what we are trying to do is we are trying to kind of put everybody together in such a way so that the patient gets better. So what is the meaning of integrative system or a medicine is that the patient or the individual stays in the center, and we are all working around the patient, not the disease. What is the difference? One is a patient and one is a disease. So patient has diabetes. So diabetes is a disease. But why did this patient get diabetes is what we are trying to work on. What is the root cause? So when you talk about integrative medicine, you have to understand that every expert spends more time to deep dive into the root cause of things. Of course, you don't always find a root cause, but at least we can find things which can change. How much of the lifestyle, does it really impact the diabetes for this individual? Not as a generic thing, but for this individual, how much is the family history impacting? How much is the lifestyle impacting? Okay. So when you have these experts who come together and integrate together to get the patient better, is what is integrative medicine. Okay. Now, one very important thing. Okay. When you talk about integrative medicine, the patient or you or just the person who's reaching out becomes part of the integrative team. So I can tell a person, go for a walk, eat well, but if you don't do it, if the patient doesn't listen to me, if the patient refuses to participate in himself getting better, then it's not going to be integrative. Okay. So you have to understand when you're talking about healthcare and sick care also, healthcare is more proactive. What I do from samne se, I'm saying that I want to make a change. Okay, that's healthcare. What is sick care? It's damage control. Okay, it is reactive. There is a problem, so I'm going to kind of give you the medicine. I'm going to make you better. So healthcare is more of prevention, and sick care is more of what needs to be done today. Tomorrow it might happen, not happen. I can't give a guarantee on that. Okay, so when you talk about healthcare and integrative medicine and lifestyle, this is what we're looking at: preventive medicine. Okay. So when we say, okay, this sounds really good, and we understand what is integrative medicine, but how do we apply it? Correct? How do we apply lifestyle? How do we apply it? Most important thing is from a part of integrative medicine is education, awareness. Okay. So when we spoke about Luke's ecosystem also, what we realized is that this was lacking. The biggest gap was the education, was the lack of awareness. Okay. Awareness and education at what level? So one is the system, the main system, the government and the policy makers and all. So obviously I'm not going to be talking about that because that's not in my scope right now. Okay. Then we look at the healthcare providers, and then we look at the individuals or the patients. So today we are going to concentrate more on the healthcare providers and the patient and the people. Okay. So when we talk about healthcare providers, you talk about doctors, you talk about specialists, allopaths, Ayurvedic specialists, lifestyle experts, nutritionists. I'm considering everybody because they're all a part of the healthcare system. Okay. So if they don't have awareness, how are they going to help anybody else? Just to give you an example, okay, this is something which has been happening in the last 15 years of my practice where I've been doing. Whenever a patient comes to me, now I'm an allopath, okay, so I am expected to give them a medicine, and then they should be all okay within a couple of days, maybe 4, 5, 7 days. Okay, so when a patient, for example, comes to me with acidity, okay, now acidity is so simple, right? Just give an antacid 3, 4 days, they should become okay. But what my approach is, unfortunately, I try to look at the lifestyle. I try to look at what could be the cause of the acidity. Is this person having tea on an empty stomach, big gaps between meals? Is he chewing really fast? I always try to overanalyze. Is he having a late dinner? Is he sleeping on the stomach? So I sit and start analyzing why this person is having acidity. Okay. So instead of the patient spending 5 minutes with me, I will obviously end up spending 20 minutes with me. And at the end of the 20 minutes, what I will do is I will give the person work. Hey, sir, आपको ये सब करना है, and then your acidity will get better. But obviously, when the patient comes to me, they want an antacid. Okay. So then I have to choose. What do I do? Okay. Most of the times in this dilemma, I don't end up giving the antacid because I feel that, just the changes will be enough. Okay. And I don't give the antacid. I tell them, try these for 3, 4 days and then come back to me. Does the patient come back to me? No. Why? And it's okay. I mean, the point is, it's okay the patient doesn't come back to me. But what bothers me or worries me, not bothers, but what worries me is that he's found another doctor who's given the antacid. Okay. Now, when I think from the other doctor's perspective, that's fine. Give the antacid because that's your role. That's your job. You have to give the antacid for the medicine. But if that other doctor or a gastro is aware that, you can make lifestyle changes and the acidity will not come back. So along with the medicine, if that doctor sends that patient back to me, how good will it be for the patient? Imagine that. So you get the antacid, you start feeling better, but then you start making the lifestyle changes also so that the acidity doesn't come back. Okay. So this is what I mean, the role of a healthcare provider. Okay. Then we talk about the role of the patient or the person. This is where, courses like what I'm talking about is the online course is where it comes into a huge amount of play, right? When you talk about, so you call it the online course, you can call it anything that you want to call it. I call it the path to healthcare course. Why? Because we are trying to empower you guys as individuals, as patients, to start taking care of yourself. Okay. In today's world where there is ample amount of information, even more misinformation. Okay. Our aim is to give you the right kind of information so that you are able to take care of yourself. Okay. It's not about medicines. It's not about supplements. It's about what you can do in your everyday life to take care of yourself. Okay. Now, of course, like I said, there's a difference between me telling you something and what you listen and what you do and what you imbibe. Okay. So that is the gap that I'm trying to fill also on an everyday basis through this course specifically. Okay. So imagine, I tell you, you have to kind of, do a 30-minute walk 5 days a week. Okay. Any doctor can say that or any expert can say that. But what we are trying to do is we are trying to tell you why. We are trying to tell you how that walk will help you improve your life, the quality of life, how it will help you control the diabetes, how it will help you control the blood pressure. Or if you don't have anything, how it will help you reduce your, the aches and pains in the body, how it will improve blood circulation, how it will improve lymphatic drainage, how it will help your muscles. Okay. If you understand why you're doing what you're doing, that's the aim. If you understand why you're doing what you're doing, I personally believe that as a human being, if you reason it out, then it is easier for you guys to actually make those changes. Okay. Sustain those changes. So one is making it and the other is sustaining. Okay. So if we say that tomorrow you do the course, you listen to people, you start making changes, and you realize that, by the looks of it, you are staying on the health side of the spectrum and not the sick side of the spectrum, that's the best thing you can do for yourself. Okay. So then tomorrow, when you imbibe it, when you lead by example, You can start spreading it to your family. You can start spreading it to your friends. You can make a community. Eventually that will spread, right? And that's the whole point. Our vision is not, it's not about just you. It is about how you can go out and start telling people what needs to be done. Of course, when I say telling people, even family and all will not listen to you directly. But if you can start leading by example, if you can start, it's not like I said, you can fall ill, but if you can recover faster, that means your immunity is better. Okay. Now, another thing from an integrative medicine perspective, what I feel is another gap is the distrust. When I say distrust, it's of course people distrust hospitals and doctors, but I feel there are other medical professionals, other healthcare professionals. Some people don't trust homeopathy, some people don't trust Ayurveda, some people just don't trust and understand lifestyle also, right? So I feel that when integrative medicine comes into play, there's so much of sharing of information, there is so much of opening of the mind, the patient is involved in their own treatment. So I feel this could be another reason of this would be another way of actually reducing the distrust among the people also. Okay. Of course, now we can't do this just like that, right? We need technology, we need so that the course is also online, so we can reach more number of people, right? So technology plays a big role in kind of helping us put this out there. All right. So predominantly, if I really had to, so this is just the beginning. So if I really had to be honest, I think this is just the beginning. I feel that I think we should be teaching this in schools. There should be like a subject, a syllabus, where you can just talk about health education in school, lifestyle medicine or lifestyle education in school. Now, why do I feel so strongly about the school part? I feel, now, just for an example, when you change early, if you start early, if you make changes early, it is easier to sustain because the rigidity in the mind is a little less. You're not set in your ways. Okay. So just an example. A lot of my patients tell me when I ask them how much oil or ghee you eat, so we eat very less. Okay. And then I ask them, how much are you giving to your kids? So no. We don't have any restriction for the kids, and they're developing and their bones needed and all. So we give them quite a bit. And I ask them why. I said, what is the biggest problem in doing this for the kids? Everything is good, probably they are being healthy. But what you have ruined is their taste buds. So by the time they are 40 and then they come to me saying that, what do I do? My numbers are high, my reports are not good. What do I do? And the first thing I point out and say, you're having too much of oil and ghee. And they'll be like, oh, I have to reduce that. And that is one of the biggest changes that they have to do, because they have to change their taste buds. Okay. They have to change the way they cook. So just imagine if the kids are not really put into a lot of oil and ghee. I have nothing against oil and ghee. You have to eat it. You have to have it. You have to cook in it. It's very good fats. No problem about it. But make sure you're not overdoing it for the kids just because under the impression of healthy. Okay. So if I feel that if the kids start learning about this, in their schools as a subject, it's so easy for them to start making those changes, start imbibing the changes at an early stage. And then by the time they're adults, probably in the next 10, 15, 20 years, the next batch of people will be definitely more on the healthier side and then lesser on the sick side. So I honestly, if I had to kind of just sum up the entire discussion, what I've told you today, I would say it starts with an individual. It starts with you making the changes. But believe it or not, it can impact an entire population, and eventually it will impact the entire nation, eventually the entire world. Okay, so it is think about it, reset your mindset, see where there's a problem, why you're not able to do things. But start today, start small, nothing dramatic, but start and think about making sustainable changes. Thank you.
Thank you so much, Dr. Akshat, for this wonderful talk. Thank you. So, Dr. Akshat, we have a few questions. If we could take that up quickly.
Oh, sure.
Yeah. So, there's someone who's asking, how can I reduce my inflammation?
Okay, so first of all, inflammation has become a very generic term, and it's a very wrongly used term. Okay, now anybody with diabetes, anybody with any chronic diseases can have inflammation, no doubt about it. Okay, but the point is that to reduce inflammation, you have to start with lifestyle, make the basic changes, understand if the symptoms are getting better, if your gut health is getting better or not. Now, one of the biggest sources of inflammation is poor gut health, acidity, indigestion, constipation, you have more toxins and all. So if your gut health is getting better, it's definitely getting your inflammation will start coming on. So basically what you have to understand is where the inflammation is, what is the source of the inflammation. But to be fair and to be honest, if you just make basic changes, you're moving more, you're exercising enough, not too much, you're eating not only good food but at the right time, you're chewing it enough, okay, you're sleeping well. Now one of the easiest ways to reduce inflammation is rest. If you sleep enough, your body has enough time to recover. So when you're sleeping, that is a time where the repair work is going on. So if you're not sleeping, how will the inflammation go down? Okay. And last but not the least, stress levels. Why stress levels? See, stress is an integral part. The way COVID came, it was not expected at all. Okay. So stress is always going to be there. But how you look at the stress, how you perceive it, how you manage it is that is what is going to help you in the longest run. So if you're able to manage your stress a little better, and not let it influence your sleep, not let it influence your eating timings and all, automatically your inflammation levels will start coming down.
All right. Thank you, Dr. Akshat. The next one, what about the ones who have issues due to heredity?
Yeah, so heredity means there is some form of there are the genetic disorders. Their genetic is a little different. Let's not do genetic. But from a hereditary family history perspective, I always say one thing. I read about this long back. Okay, so when you talk about family history of diabetes, very strong history of cholesterol, very strong history of hypertension. Okay, you have a choice. So you have a gun. Okay, you have a loaded gun. So when I'm born with a gun. Okay, now if you have family history, you're born with a loaded gun. You already have the bullets inside the gun. Okay, but it is your choice, your lifestyle, which will define when you fire it, when you trigger it. Are you going to trigger it at 20? Are you going to trigger at 40, 60 or 80? Very clear. Now, if you talk about diabetes, I don't know a family who doesn't have, family history of diabetes. There are so many. When I talk to my friends, my patients, my relatives, everybody, I have family history. My wife has really bad family history of diabetes. So we take care of our lifestyle today, so that even if I can't prevent diabetes tomorrow, I want to make sure that I can postpone it as much as possible. So bottom line, lifestyle is the answer and you have to take care of it. Of course, there are times where you need some form of medications to come in a little early. I'm not going to deny that. But are you on one medication, two medication, three medication? Are you on insulin? Are you on steroids? Are you on antibiotics? That's again your choice at the end of the day. If your numbers are in check, whether it's diabetes, hypertension, heart disease, whatever it is, your belly fat is in check, your weight is in check, your habits are in check, then the number of medications can come down and stay down. So bottom line is, it is your choice at the end of the day.
Okay. The next one is, how do you reduce acidity?
Oh, that's pretty simple. Again, I would say, like I already said, avoid tea, coffee on an empty stomach. Make sure you have something like, when you're getting up in the morning, don't keep a very huge gap of fasting also, because you have so much acid that is formed in the morning. So it's a good idea to eat something. Okay. Early dinners for sure, at least 2 to 3 hours gap between the dinner and sleep time. Okay. Make sure you don't lie down after meals. Okay. Make sure you take smaller bites of food. Make sure you chew your food very, very thoroughly so that the saliva mixes, the enzyme mixes, and the load on the stomach goes down. Okay. Make sure you do a post-meal walk. 30 minutes after meals, just do a light walk for 5 to 10 minutes. 30 minutes. If you do immediately, you can aggravate the acidity. If you wait for 30 minutes, you will actually aid digestion. Okay. So these are the things you have to be very careful. Also, sometimes it makes sense to keep a food log to actually understand if there's something in the food which is creating acid. Okay. So look at these aspects. These are very simple. Acidity is something which can kind of, be managed with looking at the changes only if you find the cause. All right. Suppose there is something called as hiatus hernia, or, the esophageal sphincter is a little loose or something, then that can take a little longer, but everything is manageable. That's important. So find the cause of the acidity and treat the cause.
All right. Thank you, Dr. Akshat.
Yeah.
So the next one we have is, please explain the importance of alkalinity in the body in regards to ABG test.
No. So these are two confused questions. Okay. When you talk about the ABG test, these are specialized tests which are done in hospitals for a reason. Okay. And when you're talking about an alkaline body, it's not really alkaline. What you need to look at is a neutral body. You don't want acidic body. You don't want a very alkaline body. So a lot of times people are, gone into so much of being alkaline with the alkaline water and, these things and all, they overdo it. So that's the problem with the human race. Anything which is good, they tend to overdo it. Now, I'm not saying alkaline water is the best way to go, but what I'm saying is that don't overdo alkaline. Okay, what you need to understand is that you have to have a neutral pH in the body, not acidic and not very alkaline. And don't confuse the ABG test. That is a very different. Of course, you're looking at the gases and all to understand what is the how the body is, because mostly when you have infection, you can go into acid, like the environment becomes more acidic. Okay, so you have to be a little careful about that, but don't try to do an ABG to find out if you're alkaline or not. Okay, that's the whole point. Yeah, Rashmi.
All right. Thank you, Dr. Akshat. Then last one, we have a lot of questions, but this is the last for
Sure.
the day. Can you explain insulin resistance?
So insulin resistance, again, it's a very accepted concept. Okay, so you have basically your pancreas are responsible. The beta cells in the pancreas are responsible for producing insulin. Insulin is responsible for utilizing your sugar levels. Now, what is sugar? Whatever you eat gets broken down into sugar, and this sugar is required for energy of all your cells, your muscles and your fat cells and everything. So you need this sugar. Okay, but whenever the sugar has to enter a cell, okay, there is a big lock on the cell, so it can't just enter into the cell. Okay, so there is a lock. So this insulin, when the pancreas secretes insulin, is a key. So when you talk about the insulin, it attaches itself into the key of the cell, into the lock of the cell, and it opens the cell, and that is when the sugar cells go inside for utilization. Okay, when we talk about insulin resistance, the problem is not that the insulin is less. It's not that. The problem is that the lock and the key are not matching each other. So because the lock and the key are not matching each other, the lock doesn't open. The lock doesn't open. What happens is the key, insulin gets wasted, goes into the blood. And on top of that, because the lock is not open, the sugar starts going into the blood. So a long time, the sugar starts going in the blood. If the insulin resistance continues, the pancreas keeps producing insulin, because what is happening is there is sugar in the blood, right? So that is an indication for the pancreas that need more insulin. Although you don't need more insulin, you need the right insulin. Okay, so you need more insulin, so it keeps producing. So eventually, the pancreas goes into beta cell exhaustion. They can't produce more insulin. Okay, and then what happens is that you go into the insulin. So this is called insulin resistance, that the key and the lock are not able to meet each other in the right way, mostly because the cells need some reactivation. Okay, that's how it works. Now, when this continues, eventually the person will go into diabetes. Okay, now one of the basic causes of insulin resistance is mostly increase in weight. Okay, when you're looking at more of obesity, it becomes difficult for the cells to utilize the insulin. Okay, and there is a very strong relation between insulin resistance and PCOD. Okay, so apart from pre-diabetes and diabetes, obesity and PCOD play a major role along with insulin resistance.
Thank you. Thank you so much, Dr. Akshat, for such a insightful masterclass. It was truly an enlightening one. Thank you.
Thank you.
So I'm really happy to see the audience gathered today to learn more about lifestyle. At Lifeless Science Institute, we offer various undergraduate and postgraduate programs in integrative nutrition and dietetics. We also have an online certificate course in health and integrative lifestyle where you can learn from the experts. Let me take you through the programs. So the first one is the certificate course in health and integrative lifestyle. We had been getting a lot of inquiries from around the world from non-science background students to have a concise and effective course for them as well. On such demand, we have launched the certificate course in health and integrative lifestyle for candidates from all educational backgrounds, enabling them to implement changes in their lifestyle. I proudly announce that our fourth batch for the certificate course is commencing from today, and we have limited seats available for this batch. So if in case you're willing to improve your health and lifestyle, fill up the application form for the certificate course, the details of which are shared with you in the chat box, and one of our counselors will soon get in touch with you. The next program that we have is the postgraduate diploma program in integrative nutrition and dietetics. This program aims to equip the food and nutrition professionals with the in-depth knowledge and skills in nutrition research methods, nutrition analysis, community nutrition, and communication, as well as food labeling and requirements. Currently, the programs will be having live online sessions, and if you would like to know more about these programs, please type a yes in the chat box. The next program is the Master's degree in Integrative Nutrition and Dietetics. It helps students to deepen their knowledge and expand their perspectives about health, nutrition, and lifestyle. Emerging as one of the most popular sciences, human nutrition integrates knowledge from diverse areas of science to present a unified view of this dynamic discipline and its applications. We are proud to announce the launch of our MSc program from this academic year. The bachelor's degree program, that is the BSc Honors in Integrative Nutrition and Dietetics, provides an in-depth insight into the science of nutrition and a healthy diet planning. This program will expand students' knowledge of nutrition and wellness, hone their skills as a nutritionist, and challenge them to think critically about health from a global perspective. You may choose to develop your careers in the field of integrative nutrition and dietetics, and we at LSI are here to help you, guide you in this decision of yours at every step. If you are the one who loves helping people heal themselves, then I must say that this is the right career choice for you. We currently have scholarships going on for all our undergraduate and postgraduate programs. And to get guidance about the career choice in integrative nutrition and dietetics, you may get in touch with one of the counselors on the numbers mentioned here. We will be having many more webinars and IG live sessions. So follow us on our social media handles on Facebook, Instagram, Twitter, and YouTube for latest updates about LSI and our courses. I know each one of us has many questions, and thus to get answers to all of these questions related to health and lifestyle, we recommend you to be a part of our upcoming certificate course in health and integrative lifestyle. Stay tuned to gain more knowledge from such webinars. Before we say a goodbye, we would like to thank Dr. Mrs. Ansi Jose ma'am for her vision and opening the doors to a rising career in integrative nutrition and dietetics. We wish to express our sincere gratitude to Dr. Akshat Chaddha. We also would like to thank the entire team at LSI for making this happen. A big thanks to all the attendees of today's webinar for their kind presence and for sending in some great questions. We wish you all the best for your career. Stay home, stay safe. Thank you, everyone. Once again, thank you for being a part.